Good morning, this is Dr. Rod Story. Let me ask you a question about COVID-19. Is social distancing still worthwhile? As we see more and more people wearing homemade masks around our community, is it necessary? Is it helpful for preventing this illness? And is this illness the one we should have feared? Is it really as bad as people say? You know, it's important now that we're about 6 weeks into this grand social experience, this experiment where people have voluntarily and involuntarily been urged to avoid public gatherings, where they've worked at home, where they've had to homeschool, where they've taken pretty extraordinary measures to try and prevent the spread of a contagious illness from reaching our community. And I would ask you the question, has it worked? Did it do what we expected it to? Well, it depends on your expectations. The first off is the flattening the curve, which everyone, I think, voluntarily embraced. And yes, I would encourage you. I think it really has done that. You know, it kept this illness from overwhelming hospitals and probably getting into facilities where many vulnerable people live, like nursing homes and other places like that. But how about keeping the illness away for good? Was that reasonable? Was that something we should continue to expect? Well, here's what we know about this illness. First off, unlike social media and its portrayal of what seems like a overwhelmingly devastating illness, we now know it's not the mass killer that it's portrayed to be. Quite the opposite. We know that for most people, probably 60% or more, it's going to be an asymptomatic illness, much like any other chest flu or cold that you might get, or even, for most, without any symptoms at all. And therein lies the challenge. We know that many people will get it, will carry it, may spread it even, and never know. We also know that it really has borne true that those individuals with heart failure, heart disease, lung conditions, immune compromised circumstances like cancer or rheumatologic diseases, they still are at high risk, and they certainly need to take every step possible to avoid getting it. So, my question to you, was it wise and good, and should we continue going forward? Well, I think there's a couple of caveats, because we know now that this really needs to be individualized, and that having a one-size-fits-all is not going to win the day. If you are a vulnerable individual, I would encourage you, we're not done yet. Continue to shelter in place and let others help you care for yourself. Avoid opportunities of being at risk, particularly as we open up over the next few weeks. If you are caring for those people, take some steps to continue keeping your world small, and wear the proper mask if you need to be around them, just so that you don't bring spread or bring illness in a way that you would never have expected. But for the rest of us, this social distancing, this wearing masks in public, it's not serving quite the experience. In fact, I think it may be preventing us from building a natural immunity that would be necessary for us to move on. And I think we particularly need to live in an informed way, a way that is not so controlled and devastated by fearfulness, but instead be wise. Let's have this conversation. Let's continue to talk about this and to move forward. Thank you. This is Dr. Rod Story.